Next, we're moving to Dr. Rajai Flores, who is with the Mount Sinai Hospital in New York City. Raja, are you on the screen?
All right, so my talk today is on toxic public housing. You can't really talk about asbestos in a vacuum. There's a lot of other things that come into play in housing, specifically public housing, when it comes to health, and that includes asbestos. So I want to put this in context of what we've been dealing with for the past several years with COVID. The next slide is a CAT scan of a patient who has COVID. On the left side of the screen, you have a scan that shows white patches in the lung. And on the other side, there is a regular CAT scan with just lung. And white in this context is very bad. That's how the patients die. And unfortunately, at Mount Sinai, we were hit by a wave of patients. It was probably one of the scariest times in the history of the hospital. We had tents in Central Park. We had patients overflowing in the hallway, and it was a difficult time. But while we were going through this, we also did some research, and the research that we did was recently published. And the next slide shows that the disparities in COVID-19 testing and positivity in New York City. So that's the title of this research paper that was published. And what we found was that in the 23,000 deaths that we saw during the period of this study, 34% were Hispanic, 28% were Black, 27% were white, 7% were Asian. And this was a very disproportionate number of people. Next slide, please. This was a very disproportionate number of people that were affected. When you look at it, Hispanics make up maybe 26%, yet 34% were affected. So it was very disproportionate. And is it because of the melanin in their skin? Is it because of other factors? Of course, it's because of the social and economic determinants of health. So when you look at our neighborhood results, you'll find that the rich zip codes showed that there were more testing done, and in the poor zip codes, there was less testing done. And I think many people will argue, well, is it because did those patient populations do worse because they had less access to medical care? And I will say no, they had access to medical care. They could go to the local hospitals, et cetera. But what was it that determined why such a high number of patients were dying disproportionately? And the next slide shows the two sides of Mount Sinai. Mount Sinai is located on 98th Street and Madison Avenue. It's in between the richest of the rich in the Upper East Side and the poorest of the poor in Spanish Harlem. The next slide shows 98th Street, which shows the St. Bernard School for Boys, where the tuition is $44,000. And then you contrast that with what's on the other side of Mount Sinai on Madison Avenue. The next slide shows the Carver housing projects. And why is that important? It's important because everybody that kept coming to work at Mount Sinai, the people that cooked the food, the orderlies, the transporters, the people that were really the essential workers that kept the place going, they lived in public housing. Spanish Harlem is the second largest public housing area in the United States. And Mount Sinai is the largest employer of patients who live in Spanish Harlem. And, when you look at the Carver houses, I would look out the window and I see the people coming right out of the Carver houses and walking right into Mount Sinai. And who lives there? Who lives in these buildings? And what you'll find is it's the secretaries, the janitors, the nurses, cops, veterans, students, home attendants. These are the people that kept coming when COVID hit us. These are the people who showed up. Now, at work, there were many people who just checked out. They didn't come back. Many retired. Many didn't show up. and we didn't know what we were dealing with. Now we have a handle on COVID, but back then we didn't know what we were dealing with, and a lot of people just checked out. But these are the people that kept on coming. And what are they exposed to? The next slide shows somebody's apartment where you have lead peeling from their walls. Who knows if there's asbestos behind there? You have children, they're exposed to lead, they have difficulty learning, asbestos exposure for many years. The next slide shows appliances that aren't working. The next slide shows frequent flooding. And while you can't see asbestos in these areas, at least not obviously, you can see mold. And you have mold here, black mold on the ceilings of someone's apartment. And if they are not taking care of the mold, what makes you think they're doing anything with asbestos? Now, I've done a lot of research when it comes to New York public housing, NYCHA, and I've tried to find where is the asbestos located. There's no records of it. This is something I am convinced that has been done on purpose because it's so expensive to abate this legacy asbestos. And I feel as if this is all brushed under the rug because it is way too expensive. But let's take something simple, for example, the mold. What happens when you're exposed to mold? You get this fungus ball, and then that can cause bleeding and make you sick. And then you have to make this big incision in the person's chest. The next slide shows us taking out a rib. The next slide shows the lung with the fungus ball in it. And then sometimes you can even have an empyema, which is where you get an infection outside of this chest space. And this is a patient with a hole in their chest. This is very, very sad, but the problem with this is that this is very, very preventable. When you see a patient like this and you realize that they are like this because they've been exposed to toxic mold, because they have asbestos in their house, because they're exposed to many other toxic conditions in their living environment, and they are paying rent every day, and they are showing up to the hospital in the middle of COVID to fight for other New Yorkers, for other Americans that are suffering from COVID, it just breaks your heart, and it makes you realize that the solution to this is not medical, it's not surgical, there's a political solution. I've tried to figure out the data out there on this so that I could do research on it. But what I found is there's no research that needs to be done on it. The data is out there. This first study was done by tenants in Far Rockaway. And what they found is that they surveyed 700 tenants. And the bottom line, they found that people that lived in public housing died at a rate of 6 times greater than those that lived not in public housing in the Rockaways. And that is, from many different things, from mold, from asbestos exposure, many lung cancers, many mesothelioma cases, but the cause is frequently swept under the rug. This study was done by Vernell Robinson, who I worked closely with when I'm a member of this organization called Community Voices Heard that's based in Spanish Harlem. And she's the one that basically did this entire study. But then NYCHA did a study as well, the New York City Housing Authority, and they found that to fix this problem of mold, which would be about $10 billion, of lead abatement, et cetera, all this would cost about $20 billion. And what they didn't even include in there is the legacy asbestos. That is just an extra layer that will hurt patients down the line. And many times you'll see walls crumbling in public housing, and you will see, I've actually gone there myself. I've gone to people's apartments and have taken samples to look at it. But it is something that is very hidden. It's expensive. People want to turn and want to look the other way because you don't see the results until many years later. Now, this next slide shows the ceiling that is crumbling, and you think, well, why not just, break that down, put some plaster on there and fix it. The problem is that ceilings like this, you're just looking at the tip of the iceberg. It's really what's on the rooftops where you have poor maintenance and garbage accumulation that allows this to take place. And then this water goes all through the walls of the housing complex, and it causes this mold, and it causes these toxic conditions. And when it comes to asbestos, there's a hotline. And when you go to that hotline, you'll find that you get prompted to many other different areas. It's not a quick, easy, oh, I have asbestos, fix it. There's always a lot of red tape associated with it. And asbestos in public housing in New York City is always in the news. This is a title that shows asbestos found in a burst pipe in a NYCHA complex. The next title, Queensbridge houses residents fed up over mold, asbestos, lead, flooding, cockroaches, and other vermin. Sue NYCHA over years of neglect. And then you have testimonials of patients. I have asbestos in my apartment. Can I sue if I moved out? Another one, I lived in NYCHA for 25 years. Several times I told housing that I had mold and asbestos. They deny that I did. 2 weeks after moving out, they said I had asbestos. So many of the tenants are made to feel silly about reporting asbestos. Many of the tenants do not report anything because they're afraid they're going to get kicked out of their apartment if they make too much noise. Now, I wanted to do a study looking at this. So I did my homework, and what I found is in 2018, there was already a big study done by the governor's office. Cuomo was there, and the head of the Department of Health at this time, I forget his name, but he was involved in this study. And the bottom line is that they found that 83%, 4 out of 5 apartments in New York City public housing had a severe health hazard, which included mold, asbestos, lead paint, rats, roaches, secondhand smoke, water damage. And it is extremely sad because this is preventable. These are the people that showed up during COVID, they pay rent. And what did they find? They found that with many of these exposures, you have asthma, you have diabetes, obesity, hypertension, heart disease, cancer. And they want to blame the victim. All of these people don't take care of themselves. These are dirty people. And they come up with a false narrative to not take care of them. But these are the people that paid rent. These are the people that showed up with COVID. And let me give you an example of one of the false. And the other thing, when you look at all these diseases, asthma, diabetes, hypertension, et cetera, they're all diseases that predispose you to dying from COVID. So it is no surprise that public housing residents had a higher proportion of deaths from COVID. But let me give you an example of one of the false narratives, and that has to do with welfare. You'll hear many people say, oh, well, they're all on welfare. When you look at New York City public housing, 87% are either actively working, collecting Social Security, veterans benefits, et cetera. 13% of public housing residents in New York City are on welfare. And in the United States, that number is 20%. So there's a false narrative going out there about what's happening with these patients. They are sick. We see them in our clinics. And like I said, there's not a medical solution. There is not a surgical solution. There is a political solution. And it really upsets me when I know that ADAO is in its 17th year to try and ban asbestos in the United States. It shows how there are so many forces that are working against ADAO. And when you look at the study that New York State did, and this shows you the political mindset that blows me away. How much money do you think the government gave to NYCHA from the state the year after this study was done, which is in 2019? How much money do you think the government gave? The big donut. So they did the study, they know what's happening, and there's zero money given to the patients who have exposure. Zero. So I want to end with this quote. that never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. And in my mind, that's ADAO and Linda at the helm. Linda is relentless. She will not give up. 17 years for a simple thing, ban asbestos in the United States. It's not that hard. It accentuates the problems that are in our political system, where you have simple solutions to problems that still can't get passed. So thank you for having me, and I'm going to keep fighting alongside Linda until we get this thing done.
Thanks so much. Thank you so much, Dr. Flores. We appreciate your comments. They were quite insightful.